So this endocrine pancreas is called as the islets of Langerhans. There is a specific island of tissue which is producing this endocrine substances. So this island of Langerhans has various cells. It has alpha cells, beta cells, delta cells and F cells. All of them will be producing different hormones. So the alpha cells, they will be producing a substance called as glucagon. The alpha cells will produce like its action is like a glucose, so that's why they named it as glucagon. Then second beta cell will produce the famous insulin. So the beta cells is the one which is producing the insulin. We will discuss more about insulin. Then the delta cell will produce the somatostatin. What is one feature we have to remember about somatostatin? It is the one which is reducing all the other hormones. Then F cells will produce the peptide Y hormone. We are going to discuss more about the insulin only. So only insulin decreases the glucose. The only insulin is the only hormone available in the body which decreases the glucose. Rest everybody is acting against insulin. That is the reason why insulin deficiency is happening, because rest everybody is playing against it. There is no backup plan. So insulin release is very important to the body. So how does insulin get released? So whenever we are taking in food, what happens to the blood glucose? The glucose level increases and it is transported to the islet of pancreas, pancreatic B cells. So there it will have a GLUT transporter and GLUT transporter type 2. The glucose will enter here. So whenever the glucose enters here, what will be there is there will be production of ATP. And there is one more channel which is called as potassium channels. It is throwing out potassium and this is sensitive to ATP. This channel is also called as ATP sensitive potassium channels. So whenever there is glucose and whenever there is an availability of ATP, this channel is going to get blocked. So this channel will get closed. What will happen to the potassium levels inside? The potassium levels inside will increase. So the positive charge inside is increasing. So it will cause a depolarization. It is causing depolarization. Whenever depolarization happens, many channels can get open and one more channel is getting open, that is the calcium channels. And calcium channels is very much known for causing the exocytosis of vesicles. The stored vesicles inside the beta cells which is having the insulin, now they will be exocytosed out. So insulin will be coming out. Not in the pure form of insulin. The insulin is usually released in the pre-pro form. The pre-pro insulin is like the precursor. Then it will form the pro-insulin. From the pro-insulin, it will come. The insulin, it comes along with some more substances. The insulin, the primary insulin is produced. And along with that, there is one more component which is produced, that is the C-peptide. Insulin, we all of us know what is the function. It is going to take the glucose from the blood and it is going to supply it to the tissues. But C-peptide, what is the function of it? If any person is taking an insulin injection, then if I have to measure the endogenously produced insulin levels, the person is taking insulin. So if I measure the total insulin, what will happen? Even the administered insulin there will be there in his blood. I cannot find how much endogenously his pancreas is working. Suppose I want to know how much his pancreas is exactly produced. I can measure the C-peptide because these both substances are equimolar, like same quantity is produced, same quantities are produced. So once I measure the C-peptide, that will give me an estimate of the insulin production, that is the endogenous insulin production. How far insulin is being produced. Insulin production can be measured indirectly. So coming to the insulin's action. Insulin is an anabolic hormone. Just remember this one point, it is a beautiful anabolic hormone. It increases the glycogen storage, it increases the protein storage, it helps to body build. So it increases skeletal muscle and liver. So both this deposition will happen. So it increases the stores in the body. So it's basically an anabolic hormone. Then coming to the diseases of the beta cell. Disease of the beta cell can be of two types. One is that there is increased insulin production and there is decreased insulin production. Whenever there is a tumor of the beta cell, what will happen? This tumor is also called as Insulinoma. Why? Because it is producing insulin. What will happen? Too much of insulin is being produced. So obviously the person will have hypoglycemia. So this is very dangerous. So one beautiful drug has been devised for this, that is the diazoxide. Since we know the insulin release, we just have to manipulate it somehow. So what this drug will do is this will open the ATP sensitive potassium channels. We saw whenever the ATP sensitive potassium channels are closed, then only inside potassium will go high and the membrane depolarization will happen, then calcium will enter, insulin will be released. Now if this channel is kept open, all the potassium will go out. So there is less chances for calcium entry and less chances for the insulin release, because in this the tumor itself is producing loads and loads of insulin. So the insulin release will be decreased, but ultimate treatment will be a surgical treatment. Then if the insulin is less, it brings us to the famous disease, that is diabetes. And diabetes is of two types, type 1 and type 2. Type 1, what is the issue here? Type 1, the issue is with the beta cell antibodies. There is production of beta cell antibodies. It is directly attacking the beta cells. So the presentation will be early presentation. Usually the type 1 persons, they will present early presentation. Previously this type 1 and type 2 was called as insulin dependent and insulin independent. But nowadays even the type 2 person might require an insulin at a later stage. That's why that terminology has been abolished. Now it is type 1 and type 2. What is the problem in type 2? There is insulin insensitivity. Insulin insensitivity. Insulin is available, but my body is not responding to it. So it is like a receptor level problem. But on a later stage, what will happen is my beta cells will go and try to produce more and more insulin, but ultimately they will go for a beta cell exhaustion. Because it is overworking, finally they will also give up and the beta cells will be damaged. That's why it is best to diagnose the diabetes early, so that the whichever beta cell is remaining at that point of time, they can be preserved. Now coming to the clinical features. The clinical features includes a classical triad of symptoms, which is polyuria, polydipsia and polyphagia. But none of the patient comes with this classical triad of symptoms. Most of the times they come with a non-healing ulcers or an urinary tract infection. So whenever these two presentation is there, still we have to check in for the blood glucose level, at least the random blood glucose level. So that will give us the clue for diagnosing the diabetes mellitus.